Do you ever roll your eyes when someone says, just practice self-care? I know you might be rolling your eyes over there now, but listen, we're going to talk about it. First of all, welcome to The Break Room, a weekly video series for Black women nurses who want to go from perpetual self-sacrifice to prioritizing self-care. And I am your host, Deetra Dennis, the self-care coach for nurses. And this is a space for nurses who value, honor, and invest in the full circle well-being of their most valuable patient, themselves, or might I say you. And if that sounds like you, welcome in. And for those who are saying, well, I'm not a nurse, it's okay. Listen, you're still welcome, invited, and welcomed here. And this is your space too, where you can reflect, pause, and be nourished. So let's get back over to it. Again, are you rolling your eyes over there because I'm talking about self-care? Hang in there with me. Hang in there with me. So today we're talking about why self-care messages haven't worked for nurses until now. Hang on to it. So listen, mainstream self-care is often sold as bubble baths and spa days, which there is nothing wrong with that. But for nurses, that feels out of touch. The truth is, surface level self-care doesn't address the depth of what we need. And the National Academy of Medicine agrees with me and says that clinicians' well-being requires systemic, structured, and evidence-based approaches. Can you agree with me on that? Yeah, and that is why when I created the services that I offer, I wanted it to be different because I have lived the experience in self-care, the deeper level self-care, and knowing that it's not about luxury, it's about longevity. So I want to share 3 approaches of why my services are different. One is nurse-centered, as I talked about. It's designed for the realities of nursing because the type of nurses that we are, our nursing care extends beyond our career. It expands to our family, to our community, because we weigh I won't say we weigh, but the weight of our community is on our shoulders because we know the importance of representation. And so again, my approach is nurse centered because I am a nurse, been a nurse for well over 30 years, and I understand our plight, right? So, 1 is nurse centered. Number 2 is culturally grounded, honoring heritage and again, lived experiences. The microaggressions experienced in every level of work that I've been in. I won't say every level, but I have experienced the microaggressions. Or when I was working at the bedside, having patients not wanting me to be their nurse because the color of my skin. No one else experienced that but us as Black women nurses. And sometimes, and no, nothing against our Black male nurses, but many times when a Black male nurse comes into a patient's room or to the office, they're automatically assumed that they're a doctor. But again, like I said, when it comes to us as Black women nurses, sometimes patients have refused me as being their nurse, again, because of the color of my skin. So again, it's culturally grounded, the services that I offer. And lastly, is practical and evidence-based. As a nursing continuing education provider, the services that I offer have to have the evidence with it, right? I have to have the research. And even when I come to you each week, I do try to have some things that I've researched about what the topic we discussed weekly in the break room. So it is important to me that it's rooted in what actually works and not quick fixes, because we don't need that, right? And what I want to do, I want to share with you some feedback from one of the nurses that went through from Superwoman to Self-Care Masterclass. So hang in there with me. I'm going to read this a little bit. So the quote, the testimony, I'm talking about the quote, the testimonial, she says that this masterclass is incredibly impactful and essential. It focused on Black women nurses. Its focus, I'm sorry, on Black women nurses is both intentional and culturally aligned, making the training highly relevant and meaningful. I especially value how the program goes beyond superficial self care tips and redefines the superwoman traits into a culturally grounded super self care framework. That distinction makes the learning not only practical, but also personally meaningful for participants. So if you want to experience self-care that aligns with you, I invite you again to enroll into From Superwoman to Self-Care Masterclass, and the link is below as well as in the bio. And you know, I always love to end with a quote, and that is, self-care is how you take your power back. So thank you for tuning in, and feel free to, share this video with someone else who you feel could benefit from the things that we talk about here. And I would love to hear comments in the chat. I don't want this to be, even though it's recorded, I don't want it to be a dialogue of me just talking. I would love to have conversation with you in the comments or in the chat. So I look forward to hearing from you. So until we see each other in the next episode, have a wonderful